up. We will have a Q&A session after Erik has finished providing his findings, and we will turn the recording off at that time. And Marlene Young has once again graciously offered to kick off the meeting. So Marlene, if you're ready, whenever you'd like, you can start.
Thank you, Lori, and good morning, everyone. We're so pleased to have you with us this morning. It's my pleasure to again have the opportunity to introduce Erik Deveraux. Erik is well known to many of us, and he has come to know well Frederick County and its philanthropic funders and the county in general, as a matter of fact, through his various work on projects here. Erik Deveraux of Deveraux Consulting has been providing consulting services continuously to a wide range of clients for 12 years. He served as executive director of a nonprofit professional and scientific society headquartered in Washington, D.C., and that experience included working closely with diverse leadership groups and boards on matters related to establishing and achieving strategic priorities of society and working closely with major national philanthropies such as Annie E. Casey Foundation and the William T. Grant Foundation. Deveraux Consulting was the prime contractor to assess Frederick County's human needs, and the results contributed to setting grant-making priorities for the Community Foundation, as well as many of us as funders of this community. And likewise, it impacted grant-making decisions moving forward as stakeholders to trends in human needs. We're really pleased that Erik has worked with us on this second official publicly shared data analysis project. The philanthropic funders met earlier this year to review this report, and it allows us for a first time to be able to compare the last 2 years of giving in Frederick County. The results of this project highlight gaps in funding as well as opportunities for increased collaboration between and among funders in filling those gaps. We've all heard that collaborative philanthropy is also known as impact philanthropy because we can accomplish greater things when we unite our resources. You'll see that the overlaying of the community needs assessment and the local health assessment with the funders data, we have a better understanding of how the larger funding community, inclusive of both public and private entities, can best meet the established needs here in Frederick County. We're excited to share that thanks to funding made possible by the Community Foundation of Frederick County, the Osherman Family Foundation, and others, that this project is transitioning to Hood College under the Data-Driven Frederick Center, where Erik is working directly with Dr. David Gersick, the chair of the Delaplane School of Business, and with student researchers. Erik is there as an executive in residence, and we know he will really champion and guide this project very well. It is my pleasure to introduce to you Erik Deveraux of Deveraux Consulting.
Marlene, thank you so much for that gracious introduction. It's really a delight to be here with everybody. I'm going to share my screen now and bring up the PowerPoint. If I can pull this off, we will find out. Hold on. I want to show the presentation version, which can be a problem. So hold on, let me do this instead. Let me do new share. Let me do this. And then we see if I launch the presentation. Can everybody see the presentation version of the slideshow now? Okay, good. All right, thank you so much. So this is, again, as Marlene referenced, this is our second report, 2 years in a row. The first one was on grant making made in 2020. This one is on grant making made in 2021. And the full report, which you can download from the Osherman Family Foundation's website, and there's a link at the end of this presentation, for those of you who haven't seen that, contains some of the data that Marlene referenced, which looks at both 2020 and 2021 together. Today, I'm mostly just going to focus on what we've learned about grant making in Frederick County, looking just at 2021. And that's calendar year 2021, by the way. In order to get us all on a common time reference, we chose the calendar year. Some of the organizations involved have fiscal years that are not on the calendar year. Okay, so there's an overview of what we're going to do today. I'm going to talk about the project background a little bit more, the methodology, the key findings in the report, some additional findings, and next steps. So a little bit of background. 6 major philanthropies in Frederick County launched this effort in 2018 to share their grant-making data. What helped them to do that? Here's the list: Osherman, the Community Foundation, Delaplane, the Community Partnership Grants within Frederick County government, the Serini Foundation, and the United Way of Frederick County. One of the things that helped them to do that is that they all use the same platform for grants management. We're not a software sales service here, so you can ask behind the scenes to Lori if you want more information about that. But they use the same software platform, which meant that they were able to think about ways in which they could collect their data about grant making and share it very efficiently. And this common management platform supports sharing that data and conducting analysis across these funders. But then we recruited other funders to join us in this effort who are not using that platform at this time, but are significant contributors to philanthropy in the county. So here are the ones that joined the effort: the William E. Cross Foundation, the Lotz Foundation, the Callert Foundation, the Will Group Foundation, and the Women's Giving Circle of Frederick County. So this brought up to 11 total philanthropies at this time. These are some of the more significant philanthropies active in the county. The first report was released on 2020 grant making on September 1st, 2021. And several other funders have declined to share their 2021 grant making data for this report, the current one, but they are aware of and interested in this initiative, and we continue outreach to try to grow the number of participating funders who are willing to share their data. We're trying to get a complete picture of philanthropy in the county and how it stands in context to a variety of needs in the county. So methodology. So we created a common system for coding the grants in terms of the following factors: organizational information about the nonprofit, such as their staff size and budget; demographic information about the person served through programs such as age, poverty status, and similar demographic factors; aspects of the work being performed under the grant, such as the topic or issue being addressed; the overall purpose in terms of the intervention; the scale of the intervention, and the type of intervention. And I'll be going into this in greater detail a little bit down the road here. And then we have a coding manual. It is available through the Osherman Family Foundation, and it is also implemented online. So there's the living version of it lives online and can be used for guiding coding of any grants. We also have a Excel spreadsheet template that we share for organizations that want to try to do this without using a grants management platform like the 6 original philanthropies in this project use. We also compiled a separate database of the names of about 2,000 organizations, most of them qualified nonprofits active in Frederick County, tied to their federal ID, which allows us to do additional analysis using the data, because we can make sure that we're talking about the same nonprofits when we're doing the analysis. So the participating funders provided their coded 2021 grant making data using the coding system. They gave it to Deveraux Consulting to compile and analyze. We used Excel in this case. At Hood College, where we're transitioning this project, we're going to be moving to much more sophisticated database platforms, which will allow for data maintenance, storage, and even additional analysis. And for the first time in 2021, we got some data about denied grant applications for the first time, which is a potentially important component of looking at gaps. The coding system was improved between 2020 and 2021 to produce more reliable demographic statistics. We still have some additional work that we did, which is now going to be used for the 2022 data. Talk about that at the end. In this case, because we're using Excel, most of the data analysis was just using simple pivot table reports, which allows us to produce different tables using the coding system. Any participating funder in this initiative receives the combined data set in addition to the analysis to use the data at their discretion. And just important to note that this data does not include most of Frederick County government's contracts and grants to nonprofits. The county supplied a separate letter, which is an appendix to the written report, documenting an additional 13 million in spending among the nonprofit community through contracts and grants. We are still working with Frederick County government and intend to keep working closely with the government to try to grow out the data that we're getting from the government in this regard. So there are some background references to use for gaps analysis, and Marlene did discuss those. The first, the 2018 Human Needs Assessment identified these three target areas: supporting families with children and making Frederick County a great place to raise children, preparing for a growing elderly population, including the rapidly growing part of the population that's over the age of 80, the so-called super seniors, and responding to substance use disorder. Now, in the halcyon days of yore of 2018, another era ago in American history, substance use disorder, of course, was very active in the news with many stories about people suffering from overdoses, the distribution of Narcan, and other similar stories that were highlighting opioid abuse. Turns out, though, in Frederick County, while opioid abuse was visible and a concern, Frederick County actually did not have a higher level of opioid abuse relative to other similar counties. It certainly was nothing compared to the disaster that unfolded just 100 miles to the west in West Virginia. But there was another component to substance use disorder which came out, which was alcohol abuse. And Frederick County has an alcohol abuse issue, which is of great concern. Experts look at opioid abuse sort of like your rapidly burning brush fire, and alcohol abuse is more like your very slow burning forest fire. But at the end of the day, it's the forest fire that really proves to be the problem. We did an update of the 2018 Human Needs Assessment in 2022, a very small update, talking to a variety of key informants to ask them to reference those three original issues and others in the aftermath of the COVID pandemic and the effect of the pandemic on Frederick County. So these three issues came out of that additional update. Mental health rose to the fore as a prime concern, affordable housing, and anything related to diversity and the interaction between diversity and disparities, socioeconomic status, age, gender, race, and location within Frederick County. Frederick County has diverse problems that are often connected to location. North County, East County, South County, the area around Frederick City, all have unique issues that are related to geography that also came out in that regard. And then there was the 22 Frederick County Community Health Needs Assessment, which was published earlier this year, and it identified these three areas: trauma and adverse childhood experiences, or also known as ACEs, diabetes and its potential co-occurrence with obesity, and mental health. So first off, we see a clear congruence between these two different needs assessments focusing on mental health. And there's been a very powerful conversation going on in the United States right now about mental health issues, which we see expressed in Frederick County in a variety of ways, including the embracing of law enforcement in Frederick County with the effort to not push mental health issues into the legal system, if at all possible. And a very strong consensus across the board that mental health needs to be dealt with by healthcare professionals. So some key findings now from 2021. First off, the participating funders dispersed a little bit more than $13 million in 2021, which is only $500,000 less than 2020. This is really important because in 2020, there was nearly $2 million in emergency funding that was put into the community by the participating philanthropies to try to get the nonprofit organizations through the fiscal crunch that they encountered at the beginning of the pandemic. It took government as long as 15 months to get authorized to spend emergency money that needed to be spent during the pandemic. During those 15 months, the funding gaps were filled through emergency funding that came from the philanthropies. The fact that in 2021, we're only looking at $500,000 less means that the philanthropies have continued to step up their funding during COVID. About 84% of the spending was on ongoing projects, and 16% was for new initiatives. The grants continued to go to larger, more established nonprofits as measured by organizational age, staff size, and budget. And this has spawned a conversation among the philanthropies about their role in supporting new nonprofit organizations or new initiatives within existing nonprofits and versus sustaining existing initiatives. That conversation is a very vital and interesting conversation, and this report has helped to promote that conversation. Denied grant applications totaled just a little bit over $3 million. Now, we don't have complete data on denied grant applications, and it's also important to note that some of these denials were denials by one philanthropy saying, no, we're not going to fund that, but another philanthropy may have funded a similar proposal from the same organization. So we're still trying to figure out how to deal with the information about denied grants, and we're not overplaying it in this report. About 1.9 million was denied to nonprofits that were receiving grants from the participating funders. So there was other sources of funding coming. And then 1.3 million was denied to nonprofits that were not receiving grants from the participating funders. Give me 1 minute, we'll go to the next page. There was a common reason for denial, and that was funder mismatch. Funder mismatch means that nonprofit organizations were submitting grant applications that did not meet the expectations or overall framework of the philanthropy to which the grant was submitted. And there were several components of this. There was whether or not there was sufficient emphasis on Frederick County in the work that was proposed to be done, or there were issues related to topics. So the different philanthropies in Frederick County have topics that they will fund and issues that they support, and ones that they will not. And sometimes nonprofits did not understand that, did not get the message, and submitted grant applications that simply were outside the scope of what the philanthropies were willing to fund. So some more key findings. So a substantial majority of funded organizations receive support from just one of these philanthropies. That's 69%. And only 15 of all of the nonprofits in our data receive support from the majority of these participating 11 funders. Here's what that looks like as a distribution. So again, this is a count of all the nonprofits, separate nonprofits in the data. 219 of them received a grant from just one of the participating funders in this project. If you look at the majority, which starts at 6 or higher, this is just 15 nonprofits received grants from a majority of the participating funders. I'm guessing many of you know which of these nonprofits these are off the top of your head. These are some of the larger and more prominent nonprofits, especially visible during the COVID pandemic regarding addressing immediate issues that the pandemic caused related, among other things, to poverty. Most grant dollars were awarded by internal processes within the funders, not through competitive applications. So only 1/3 of the dollars were awarded by competitive applications. This means open calls for proposals and a selection process by a panel reviewing the proposals on a competitive basis. The rest of the grants were determined by processes internal to the philanthropies, whether it was trustee directed or trustee discretionary, donor designated, donor advised, or this little pie slice, the 2% here, the 2% are grants that were determined primarily by the staff within the philanthropies. And this has also promoted a conversation within the participating philanthropies about how they make grants, the role of the community in influencing their priorities, and whether they have competitive or non-competitive grant processes. The majority of grant dollars went to support programs and services. That's restricted funding in the lingo of philanthropy, with significant funds still going to general operations and capacity building. So what you can see is 53% of all the funding went to support programs and services in restricted grants. General operation grants were 35% of the money, capacity building 9%, and everything else fits into this remaining little set of slices. A couple things to point out. First off, there is a growing support within these philanthropies for unrestricted general operations, and there's been a growing conversation within the philanthropy community nationwide in the United States about moving away from restricted grants toward unrestricted grants, and that conversation continues. There's still a lot of support in Frederick County for capacity building, but capacity building grant numbers are probably down a little bit during the COVID-19 pandemic because so much money was shifted toward trying to address immediate needs that nonprofits were supplying in the community. We've also promoted a conversation about the very, very slim, teeny bit of funding for advocacy, policy, and research, and particularly the need for perhaps more funding for advocacy, which is to be distinguished from lobbying. Lobbying is when you're lobbying for a particular piece of legislation in front of, let's say, the Frederick County Council, or in Annapolis in front of the state legislature. Advocacy is advocating on behalf of an issue. And the number one issue that intersects with the human needs assessment, where there's been a conversation about advocacy, is affordable housing. affordable housing is very expensive. The philanthropies are not going to get in the business of building housing. If they pooled all their resources, they might build one apartment complex. That's not the route to go, but their route might be to increase support for advocacy around issues of affordable housing in Frederick County and continue to promote a conversation that intersects the public, the private, and the nonprofit sectors regarding that topic. So if you look at the cycle of nonprofits here, what you see is this is sort of the nonprofit cycle. It moves from research and planning through capacity building, general operations, program services, advocacy and policy, hopefully eventually to evaluation, because evaluation is your feedback loop that goes here. I've highlighted these boxes in yellow because these are areas which are not receiving a lot of funding. And again, this is promoting a conversation among the philanthropies in this project regarding, do they want to direct more resources to advocacy and policy making? Do they want to devote more resources toward evaluation? And that's a very healthy conversation that is now being fueled by having access to this data. Most grant dollars were devoted to efforts at two scales, individual and organizational. Sorry, flipped too fast. So scale refers to the level in the community to which an intervention is taking place. So in cases where you're talking about programs and services that are touching human beings, 45% were focused at the individual scale, 42% at the organizational scale, which is money that's being sent to nonprofit organizations that deal with general operations and capacity building and other organizational focused efforts, strategic planning, et cetera. 6% at the family level, meaning that the goal was to affect families as a whole. 6% as the community level. A community level intervention, for example, is public art. When there's funding for public art among these philanthropies, and when public art is built, that's affecting the people at the community level. There's very little funding directed at the group level, which would primarily be around different demographic groups in the community. So this has also fostered a conversation about the scales at which interventions are being funded. And here's just a little infographic that deals with how these scales relate: individual, family, group, community, and then sort of overlaying across it organizational level scales. The group conversation is important because in the aftermath of a variety of concerns about equity within the community, a lot of conversations about equity are operationalized at the group level. For example, equity among different socioeconomic groups, equity among different racial and ethnic groups. But there's not much funding going on in Frederick County that is specifically keyed on the group level at this time. The majority of grant dollars supported efforts related to human needs and education. Those are the two biggest categories in terms of topics and issues. So 48% went to human needs, all categories, 22% to education, all categories. The report has additional fine-grained breakdown of some of this. Arts and culture, 9%, religion and spirituality, 7%, personal development, non-athletic. One example of personal development, non-athletic is the Boy Scouts and the Girl Scouts, for example. But there's also services for adults in here, such as adult literacy, and public services, all categories, historic preservation, and all other. So there's a real strong tilt in the work that these philanthropies are doing toward human needs, directly or perhaps indirectly through education. Most of the grants for human needs still are going to palliative or restorative interventions, not prevention. I'll talk about why this matters in a minute, but we'll go through. So palliative interventions, almost half. Restorative or curative interventions, about a little bit more than a third. Preventative, about 9%, which is an increase from 2020, but still a small percentage. All modalities combined at once, 6%, and then not applicable, 1%. So palliative interventions are interventions that are just trying to temporarily fix a problem and keep it from getting worse. So a classic example in the case of housing is emergency housing in shelters for people who've recently become unhoused, okay? That's a palliative intervention. It doesn't give them permanent housing. It doesn't solve the long-term problem. It just keeps them from being on the street. Restorative curative is putting people back into housing. Preventative is preventing people from becoming unhoused in the first place. And in the world of program evaluation and public policy analysis, Preventative interventions have the highest return on investment by far. And therefore, it's important to try to do what you can to increase preventative interventions because they make the money go the farthest. Restorative, curative the second, and palliative the least. That's why we've looked at this issue and promoted a conversation among the participating philanthropies about prevention. And one of the problems with prevention is it doesn't have a lot of champions in the community because prevention sort of prevents the spending of money on particular problems. And the most of the champions in the community are those that are using money to solve problems after they've occurred. It's just a fact of life. But prevention is still worthy of more attention in this regard. It's not surprising, by the way, that we're still seeing a large emphasis on palliative interventions for several reasons. But one is the ongoing effects of the pandemic are still causing disruptions all across the fabric of Frederick County and putting people at risk of becoming unhoused or having health issues or other similar concerns. And palliative interventions, of course, are humane interventions designed to reduce human suffering. About 48% of all spending in 2021 went to support nonprofits and community groups in Frederick County that are engaged with issues of poverty. And that's how it was also in 2020. About half of all of the money went to organizations that deal with poverty. Grant funding focused directly on demographics of interest varied from 1% to 19% of the total. These are not exhaustive categories, they overlap, so we're counting the money in different ways, same money in different ways. About 3% of the grant money was specifically focused on the needs of women. About 1.3% specifically on the LGBTQ+ community. For persons experiencing disabilities, almost 19% of the money was focused in that direction. Military veterans and families, 16%. The English as a second language population in Frederick County, about 19%. Again, this can overlap. The money can overlap, but this is how it cuts up in these particular terms. And there were noteworthy spending gaps in the 2021 data related to issues that connect to obesity and therefore to diabetes. It is the case that most of the targeted health spending on physical health, very targeted spending on physical health in 2021 was focused on cancer. Now there's some idiosyncratic things going on there, including the completion of capital campaigns for new cancer treatment facilities in Frederick County. Those capital campaigns are now completed. Be interesting to see in the 2022 data, which will be available, analyzed and available in 2023, whether there's been a shift away from cancer and similar issues. But it's worth noting that the previous Frederick County health assessment, 3 years earlier, focused on chronic illnesses, including cancer. So you sort of see this ongoing effect of that assessment in terms of spending priorities. There's still a need for more spending on mental behavioral health and substance use disorder in Frederick County. The total amount of spending is not that great, and the need remains very high. And still a need to focus on programs and services for super seniors over the age of 80. And again, this is your largest growing segment of the elderly population in terms of percent change. And I'm sure many people like myself on this webinar have relatives who have crossed into the super senior category and are aware of their needs, which are a different category of needs than those who are younger. So these are some gaps that came out, and there's other gaps that have been discussed by the participating philanthropies. Next steps. In terms of methodology, we have just deployed for 2022 a new coding system for race and ethnicity. This has proven to be a very, very difficult issue to code, and for a variety of reasons. It turns out that some of the participating nonprofits who are very connected to issues of race and ethnicity have been reticent to code their own grants that way. There's been discussions with them about trying to end that and make them aware that it's important that we know that they do have a focus on particular issues of race and ethnicity in Frederick County. And there's also been a broadening of what is the concern here, not just about specifically having programs that are focused on racial and ethnic groups within Frederick County, but also raising awareness of issues connected to race and ethnicity, issues like that. So we hope when we analyze the 2022 data, for the first time in this project, we will have good data on race and ethnicity. We have not had good data We have not published it because we did not see the benefits to anyone of publishing erroneous data that it clearly was not capturing the full nature of this issue. More analysis of data on declined applications, more drill down into that, better understanding of what's going on with the declined applications. The shift to a better database platform at Hood College will facilitate this greatly. We're still recruiting additional funders to participate in this initiative. Again, the ultimate goal is to try to sweep up as much information about philanthropy as we possibly can. And working, as Marlene said, with the Data-Driven Frederick Center at Hood College to transition this effort there. Starting in spring of 2023, I'm an executive in residence. We've begun the process of organizing this, and Hood College brings to the table some great resources that will enable us to do a much better job in maintaining the data and analyzing it over time. I'm really excited to be working there with a community of really great young people who are interested in data science and data research and are going to get involved in this initiative. I also just really want to thank David Gerzik, the head of the Data-Driven Frederick Center and the director of the Delaplane School, again, for inviting me in to do this. And then in looking at funding practices, continue to discuss potential gaps reinforced by findings in the next rounds of this process, and just fostering a conversation among all of the nonprofits and the philanthropies about what are the gaps in Frederick County, how are they being addressed, how are they not being addressed, what are new issues that are arising, and using this data to drive decision making in a decentralized, most likely in a decentralized format between the different participating groups. Continue discussing how to increase support for prevention. This is just something that I've very strongly advocated on my own to the group as well, that prevention is crucial if you're actually going to get real effects from spending related to human needs. And there's so many issues in Frederick County for which prevention can make a big difference, whether it's substance use disorder, or persons experiencing homelessness, or persons struggling with behavioral health issues, or now this focus on diabetes. And if you look at the numbers about diabetes in the United States and how it's going to affect the healthcare system, folks, it's just truly terrifying. There's no other way to put it. It is incredibly expensive to treat diabetes from a palliative direction. And I'm sad to note that around where I live, one of the burgeoning organizations with new branches opening every day is DaVita Dialysis, which is palliative care for diabetes related symptoms. And it's just very disturbing to see that as one of the trends in my community. And considered increasing funding for advocacy, again, on issues such as affordable housing. Affordable housing is not going to be solved by the private sector, the public sector, or the nonprofit sector, but it could be addressed by a fruitful interaction among the three, marshaling their resources together and recognizing the need for it. And one of the concerns that the community I know in Frederick County has is it does not want to go down the road that some communities in the United States are well down right now, where essential workers providing healthcare, childcare, restaurant services, and catering, or many other essential services in the community cannot afford to live nearby. And if they can't afford to live nearby, then this raises their commuting costs. And pretty soon you start a spiral where you cannot get workers to provide these essential services. And housing is really one of the crucial components of that. There are communities around the United States that Frederick County does bear some passing resemblance to in many ways because of its being a very, very wealthy place in many ways. In the United States, one of the more wealthy places where the community becomes a home for a very wealthy homeowning population, but everyone else who works there lives 3 counties over. And I don't think that's the future vision that Frederick County's leadership has for the county. So here is a link to the full report online. And I believe this presentation in PDF format will be emailed out to everybody who wants it. And so you'll have this link if you haven't seen it, and you can download the report and read the full report yourself. Let me stop there and take questions.
And we'll stop recording at this point.